I'm Jennifer Jackson, an MSN student at the University of Texas at Arlington. This is a role play exercise where I present a one-page brief to my congressman's legislative assistant to garner support for H.R. 2083, the Registered Nurse Safe Staffing Act of 2015. Greetings, Ms. Fields. I'm here to speak with you today and to seek your support of the Registered Nurse Safe Staffing Act of 2015. Are you familiar with H.R. 2083?
Yes, I know about it. Why should the congressman support it or vote for it?
Let me begin by asking you if you're familiar with the issue of safe staffing and why it is so important.
Well, I am somewhat. Tell me more.
There you go. Without optimal RN staffing, patients risk longer hospital stays, increased infections, avoidable medication errors, falls, injuries, and even death. The solution is a Medicare participating hospitals would be required to establish a committee composed of at least 55% direct care nurses to create nurse staffing plans that are specific to each unit. The Safe Staffing Act protects nurses and patients. Hospitals are reducing labor costs by understaffing or eliminating RN positions. The result is lower nurse retention rates and increased readmissions. Increasing the number of RNs per patient improves clinical and economic outcomes. Here's what the Safe Staffing Act can do. It keeps patients safe.
How will it keep patients safe?
Adding RNs to unit staffing has eliminated nearly 1/5 of all hospital deaths and decreased the risk of adverse patient events.
How so?
It will decrease medical errors. Important because the Centers for Medicare and Medicaid Services denies payment for preventable hospital-acquired injuries or illnesses, and it reduces costs.
How will it reduce costs?
Over 4 million avoided extra hospital stays related to adverse patient events. Increasing the number of RNs can yield a cost savings of nearly $3 billion.
Is there anything else like it already in place?
Actually, 7 states, including Texas, have already enacted safe staffing legislation using the Registered Nurses Safe Staffing Acts Committee approach. Oregon, Texas, Illinois, Connecticut, Ohio, Washington, and Nevada. May I ask for the Congressman's support when H.R. 2083 comes to him in committee or is brought to the floor for a vote?
Yes. Thank you for bringing this important issue to my attention. I'll do all I can to see that the congressman gets it to the floor for a vote.
Thanks, Ms. Fields.